Atrial fibrillation, or AFib, is a chaotic or poorly organized rhythm of the heart. If left untreated, AFib can lead to many complications, including blood clots, heart failure, or stroke. Dr. Roy Robertson shares more.
What typically happens in the collecting chamber is that the collecting chamber is no longer organized in the way it contracts. So it doesn't contract in a normal state, pushing blood into the pumping chamber and then blood leaving the pumping chamber and then going to the rest of the body in a synchronized manner. What really happens in atrial fibrillation is that through a lot of different circuitry, the cells of the collecting chamber themselves all start to fire. And so multiple impulses then try to hurry up and get through the conduction system of the heart to the pumping chamber. And as a result of that, heart rates vary greatly with atrial fibrillation.
How does a varying heart rate affect cardiovascular function?
Typically, if a person is young and healthy and goes into atrial fibrillation, their heart rate might be 170 or 180 beats a minute because the conduction system can handle that. But as we age or as one is taking medications and other things, the conduction system may not be so receiving. And so even though the collecting chamber of the heart may be sending 700 impulses a minute to try to get to the pumping chamber, the conduction system itself will sort some of that out for us and help us out to maintain a more normal heart rate. But heart rates can vary from way too slow in the 20s to way too fast near 200 in atrial fibrillation. And so that variation in heart rate is one of the reasons that people really don't tolerate that rhythm very well.
It's very common for a person with AFib to go years without experiencing any symptoms. Dr. Robertson explains that monitoring your symptoms with new technology can be life-saving.
Asymptomatic atrial fibrillation is in the same category as symptomatic atrial fibrillation in the sense that it does carry with it that same risk of stroke. But certainly some patients will develop symptoms and then they'll know, I don't feel well, what's my problem? And eventually we'll get to recognition by an EKG, where they put the actual leads on and monitor the cardiac rhythm. And in today's world of modern technology, apps on the phone, I take my pulse and I find out, gosh, normally my pulse is in the 70s and today it's 114. And that's just really odd. So that would be something that you would want to bring to the attention of your healthcare provider.
After a physician makes a clear diagnosis based on electrocardiogram results, Dr. Robertson shares that each patient should receive an individualized treatment plan, which could include blood-thinning medications or ablation treatments.
We have medications that we can give that would promote you going back into a regular rhythm and keeping you in a regular rhythm. So those are specialized heart medications that are necessary to help drive the heart and help it think about how it wants to conduct. The other thing that we do to manipulate the heart is a procedure called left atrial appendage ablation. So what we do in that case is we take a device and we actually put it inside the heart in what's called the left atrial appendage, which is the area of the heart in which most commonly blood clot. And by excluding that from the circulation, we decrease the risk of blood clot mobilization. And some of those patients then also can come off of their blood thinner and be safe from the risk of stroke.
This has been Making the Rounds, brought to you by Parkview Health.